All right, welcome back to our very first webinar of the day with Dr. Candice Walker from Baylor Scott and White. As mentioned yesterday, we gave some of our presenters the option to pre-record what they would normally talk on in person, and Dr. Candice Walker chose that, as did labor and delivery. So still comment if you have any questions for Dr. Walker. She is absolutely incredible, has just so much knowledge. She's going to be talking today about COVID-19, pregnancy, what that looks like, things to expect, questions to ask, just all of the things that you normally don't get out of your very, very quick OBGYN appointment. So with that being said, I am going to go ahead and start Candice Walker off.
Hello, I'm Dr. Candice Walker. I'm an OBGYN at Baylor Scott and White in Lakeway, and I am thrilled to be a part of this year's Bloom event, Bloom 3.0. On behalf of Drs. Romberg, Vokes, and myself, a big thank you to Allison Mack for having us a part of the event this year. Well, this has been an extraordinary year to say the least. I never would have imagined in my lifetime to be faced with such challenges. One that is on the forefront of my mind and that of my pregnant patients is the global pandemic of COVID-19. For the next few minutes, I hope to somewhat ease any concerns that you may have and answer some questions about this virus. Because this is a recording, I thought I would share with you some of the top questions that I received from my pregnant patients. What are the current visitor policies in the hospital? Will my baby be taken away from me if I test positive for COVID-19? Can my family and friends come to my home after the baby is born? Should I work remotely from home while I'm pregnant? Am I at increased risk? Will I know the difference between normal changes of pregnancy and COVID-19 symptoms? So here are the current statistics. As of the beginning of this month, there have been 20,216 cases of COVID-19 in pregnant women in the United States. 4,796 women with COVID-19 have been hospitalized, and unfortunately, 44 women with COVID-19 and pregnancy have died. While it's been stressed that older age groups are at increased risk with this virus, older age groups certainly are not the ones who are pregnant, and therefore the most commonly affected age group is between the ages of 25 and 29. Hispanic women have been the most commonly affected, followed by Caucasian women and African American women. The most common symptoms of COVID-19 in pregnancy, according to a small study coming from Wuhan, China, include fever, cough, and lymphopenia. Lymphopenia is a decrease in white blood cell count. Okay, ladies, here's the part where I hope to comfort you, at least a little bit. But most pregnant women diagnosed with COVID-19 likely will have mild symptoms. This is the good news. The bad news is that if a pregnant woman has severe COVID-19 symptoms, she will more likely need an admission to an ICU and need a breathing tube or ventilation compared to a woman who is not pregnant. And women with pre-existing health conditions, diabetes, obesity, high blood pressure, and I'll add asthma or any chronic respiratory condition will more likely have severe COVID-19 symptoms. So how could COVID-19 impact pregnancy outcomes? Well, for obvious reasons, we can't do large studies on pregnant women, so unfortunately, there's a lot that we still don't know. For the last several months, there have been some studies that suggest that COVID-19 may be associated with preterm birth, fetal distress at the end of pregnancy, or fetal growth restriction. But again, we need more studies to confirm this. We used to believe for the past several months that there could be no vertical transmission of COVID-19. Vertical transmission is when the virus has passed from baby to an unborn child. More recently, there have been studies that show that this may not actually be the case. There was actually a case of a woman who had severe COVID-19 symptoms. She had pneumonia and was very sick and therefore had no direct contact with her baby immediately after birth. That baby did ultimately test positive for COVID-19. We've seen the virus appear in the placenta and the umbilical cord. So more likely than not, this virus can be transmitted vertically. Fortunately, the rate of stillbirth and the rate of newborn deaths is actually very low. The C-section rate has been reported to be an extreme high, between 42 and 92%. Fortunately, this doesn't appear to be as a result of fetal distress, but more for maternal benefit. So if an OB or the team that's taking care of that mom believes that her outcome will be better by having a rapid delivery, then a C-section may be performed. Breastfeeding and COVID-19. If I have COVID-19, can I breastfeed my baby? In the OB-GYN world, as with most illnesses, the benefits of breastfeeding will outweigh the risks of potential exposure. But it's imperative that moms take all precautions to minimize that risk of transmitting that virus to baby. So this includes frequent hand washing and wearing a mask when breastfeeding. It is not thought that COVID-19 can be passed through breast milk, fortunately. Is separation encouraged if a mom is positive for COVID-19? Per ACOG, which is the American Congress of Obstetricians and Gynecologists, rooming in is really encouraged. But again, it is important to take those precautions to minimize exposure between mom who is positive for COVID and baby. Now, there are some situations where separation is actually encouraged. So if a mom is very sick, she's in the ICU, she has severe pneumonia, it's actually best if she can't take care of baby for baby to be separated from mom. Also, if a baby is deemed to be higher risk, so those preemies, those babies that are born with severe illnesses at birth may pose a higher risk and are more likely to get sick, and so it may be in baby's best interest to be separated. Any baby that's positive for COVID-19 doesn't need to be separated from mom. So when is that risk of transmission between mom and baby deemed to be the lowest? So let's say mom is positive for COVID-19. When is it safest for her? When can she breathe a little sigh of relief that she's not going to transmit that virus? One thing that we're looking for is that it's been at least 10 days from the onset of symptoms. Now, if a mom has been severely sick, has had pneumonia, has been in the ICU, we're really looking for closer to 20 days since the onset of those symptoms. The second criteria that we're looking for is not having a fever for at least 24 hours. And this is without any fever reducing agents like Tylenol. And third, if mom's symptoms are gone, then she is likely going to pose a low risk of transmitting that virus to baby. So how do pregnant women minimize their risk of acquiring COVID-19? Number one, keep those prenatal appointments. Speak to your OB-GYN. Your OB-GYN is going to have the latest research, the most updated studies, and they're also going to be the ones that are going to tell you if the symptoms that you're experiencing warrant any additional testing. Also, wear a mask and any other personal protective equipment at work or in public. Wash your hands frequently. Maintain social distancing and limit contact with other individuals as much as possible. Now, this goes back to the original question that I posed about having friends and families over after baby's home. This is a very tough question, and the answer is not very direct. We are in a very unprecedented time, and unfortunately, this is a virus that will likely last for the next several months. So we're going to have to be a little uncomfortable. At the same time, we want to, enjoy this miracle of having a new baby and enjoy friends and family meeting that baby. What I typically tell my patients is tell grandma, tell uncle to quarantine for 2 weeks prior to coming over. Now, if your brother was at the neighborhood bar or at the neighborhood restaurant a couple of days ago, it may not be best for him to come over. But if you know that they've been quarantining, they're wearing their masks when they go out, then it's likely safe for them to come over and meet that baby. You are Mama Bear. This is your baby. This is your family, and it's imperative that you protect your family. So you may hurt some feelings, but if they can take that time to quarantine, then they should be safe to come over. The next step, be compliant with all of your medications and keep up with refills. We already talked about women who have any pre-existing conditions being at increased risk. So take your asthma medication, take your blood pressure medication, take your thyroid medication. And I'll even go a little further for those who are listening, who are not yet pregnant, but thinking about getting pregnant, optimize your health. We say this whether there's a pandemic or not. The healthier you are when you go into a pregnancy, the healthier your pregnancy will likely be. So take that time to take the very best care of yourself before getting pregnant, and take good care of yourself while you're pregnant. Finally, get your flu shot. What does flu have to do with COVID? Not much, except the two are both very severe respiratory illnesses that can impact pregnant women a little more severely. So the flu vaccine can be given at any point in pregnancy. It is not a live vaccine. It doesn't cause the flu. We're entering flu season. So with flu being around the corner and with this pandemic, just minimize your risk and go ahead and get your flu vaccine. Some final thoughts. The one thing that I likely didn't answer during my talk is visitor policy. The visitor policy changes from hospital to hospital, and it really does change from week to week. At our hospital, the current recommendation or the current policy is that A laboring mom can have one person, whether it's support person, spouse, significant other, and it has to be the same person for the duration of the stay. As of last week, that person can come and go between 11 a.m. and 6 p.m. If they leave after 6 p.m., they can't return until 11 a.m. the next morning. 2 months ago, the policy was completely different when those cases were higher. The same person had to stay for the duration of that mom's stay. So as we complete a holiday weekend, as our kiddos are going back to school, and as we enter flu season, I suspect that the cases of coronavirus will go up, and so those policies will change. So keep in contact with your obstetrician, keep in contact with your labor and delivery to know what the most current recommendations are. Well, that's all I have. Congratulations to our expectant moms. I wish you the best of luck. For those who are delivering with us at Baylor, Scott & White, and Lakeway, we look forward to taking good care of you. Hang in there, ladies. We've got this. Thank you.
She's live. She's amazing. She's amazing, even recorded. I know that many of you do have questions for Dr. Walker. And if you do, we can put you directly in touch with her. She is absolutely available to answer anything that you may, any questions that you may have. Okay, so next up, we have got the Labor and Delivery Department of Baylor Scott & White. So this is not quite the end of the webinar, but love the comments coming in. And with that being said, I will get them started.
Hi, welcome to Baylor Scott & White Lakeway. My name is Candice Walker. I'm the manager for Labor and Delivery. I'm here at the hospital. We're going to give you a quick tour so that you can see what we're all about, talk about a few things. The first thing that I'd like to highlight is our lovely garage that we have over here. On the first floor, we have dedicated parking for moms to be, so you don't have to find a spot up on the upper decks. You can just park on the first floor and walk straight in. After hours, if you come into the hospital, you would go through the emergency department entrance, which is over here to my right. Other than that, on normal business hours, we're going to come straight through to the main entrance of the hospital. This is our main lobby here in the hospital. We have lots of seating over to your right, as well as a new gift shop. And to our left, we have our emergency department, and that was where you come in on an off shift. One thing that you're going to notice, which is new for COVID-19 pandemic, as you come into the hospital, we have a screening station, and this is where every person that comes into the building, including staff members, visitors, patients, everyone will come over to the screening station, and they will have their temperature checked and a set of questions asked. If they clear all of those items, they will be moved on to see their loved one or to come into the hospital and be seen. So we're going to go past here, and this is where they come into the L&D elevators. And the Labor and Delivery Department is on the second floor. The entire floor is the L&D and Women's Services. So immediately when you exit the elevators, you're going to come into the Labor and Delivery and Women's Services waiting area. We have over here to my right a coffee bar, as well as some areas to attain water. And we have lots of space here, as you can see. To our right is the Labor and Delivery Department. To our left is going to be the mother-baby unit, where you will go after you deliver your baby. The first place that we're going to go is into the Labor and Delivery Department. And this is where you're actually going to deliver your baby, recover before you go out to postpartum. We do have an infant security system that encompasses the entire second floor. You are not able to get in without a badge that has women's health information on it. We have 6 labor and delivery recovery beds. Each room has their private shower. It's a private large suite, and we're going to go take a look at one. We have an additional small waiting room in the back. This is more for if you're having an epidural and your loved one would like to step out of the room, they can stay there. This is our labor and delivery suite. You can see how large and spacious they are. Each one of them has a lovely pull-out sofa for your significant other, father of the baby, or your visitor. And they all have these lovely views out the windows, and they're all set up to take care of your infant, whether it's a normal, no complications delivery, or your baby needs a little bit of assistance. We have everything that we need in this room. In this room, you'll stay for 2 hours after you deliver your baby, and then you'll move out to the postpartum unit. Occasionally you'll stay in this room. Most of the time you will move out to that postpartum unit, which is what we're gonna look at next. However, on our way out, I'll just show you all that you all have a private bathroom, and they are actually quite spacious as well, with a full shower. As we're walking down to the next room, I just wanted to talk to you a little bit about our doctors and all the providers that we have here in the hospital. So we have 3 obstetricians. They've all been with us for quite some time. We're very happy to have them. And they all do call 24/7. So we have people in the building able to take care of your baby and do an emergency C-section if we need to do that. And speaking of, we are standing in front of the operating room suites. And in back here, we have 2 fully operational operating room suites where we can do an emergency cesarean section or anything else that we need to do to take care of you and your baby. We have this ability 24/7. We have anesthesia coverage 24/7. So if we had to do an emergency in the middle of the night, we have that ability and we can do that. We also have neonatology coverage here. Neonatologists, of course, are physicians that are specialized in small babies. So they have the ability to take care of babies small or large. So if we have babies that come in and deliver a little bit early, we have the specialists here to take care of those babies. If they deliver early and they need specialized NICU care, we have relationships with Dell Children's Center as well as St. David's Medical Center, and we can transport those babies to a higher level of care if that's necessary. Here in this facility, we have the ability to take care of babies that are 33 weeks and older. So let's go to the postpartum side. And so as you can see, even to go between units, I need my security badge. And this brings us into our mother-baby unit side. We're gonna just peek into a postpartum room. And as you can see, these are spacious as well with lovely views of the hill country. We also have pull-out beds in these rooms for your significant other, father, baby, or your visitor. And this is the room that you'll stay in for the remainder of your stay until you're discharged home with your new baby. So we're excited to have you. We can't wait for you to come and deliver your baby here with us in Lakeway. We are very excited. Come and see us.
Get those last minute comments in before we shut everything down on this webinar. I know that we've got some questions, so I'm just responding there. I have direct access to the Baylor Scott and White team, Dr. Candice Walker, as well as labor and delivery. So if anyone's got any questions, please shoot me an email. You can reach me directly, info@austinmoms.com, and we will forward those directly over to the team so that they can get with you. Again, this is our 6th year hosting Bloom for new and expecting parents, and we've been hosting it at Baylor Scott and White. And so normally you would have been able to see the beautiful hospital in person. So that is why the labor and delivery team put that video together, so that if anyone is interested in delivering at the gorgeous hospital, I mean, seriously, I've been to several hospitals and it's by far the prettiest. The rooms are enormous. So if anyone is interested in that was a great video. So next up, we have got live Dr. J with Empower Family Chiropractic. So if you've got any questions, she will be live to be able to answer those. So we will see you in a minute. Thank you.